New study alert for all my patients that suffer with painful diabetic peripheral neuropathy. This study was just published in April of 2025 and looks at magnetic peripheral nerve stimulation as a treatment for chronic neuropathic pain. A little bit of background on magnetic peripheral nerve stimulation first. It's FDA approved for post-trauma, post-surgical neuropathic pain and painful diabetic peripheral neuropathy. The magnet is placed over the area where the patient has pain. It induces a strong magnetic field and causes neuronal activation in the area. It primarily works on sensory and motor fibers rather than pain fibers, so it's pretty well tolerated by patients. So back to the study, it was a randomized controlled trial that included 71 patients. The patients were either randomized to magnetic peripheral nerve stimulation or sham therapy. The primary endpoint was greater than or equal to 50% pain relief. The patients underwent a total of 10 sessions, each session lasting about 13 minutes. They evaluated the patients at 30 days. At 30 days, 72% of patients in the treatment arm had greater than or equal to 50% relief, which was the primary endpoint, and 0% of patients in the sham group had greater than or equal to 50% relief. At 30 days, they then allowed the patients in the sham arm to cross over to the treatment arm and had equally impressive results. This treatment option could be really promising. We'll have to see how it plays out in the future. Currently, the treatments we have for neuropathic pain include things like pregabalin or duloxetine, which can come with side effects, or invasive treatment options like spinal cord stimulation. So this option is interesting because it really doesn't have any side effects and it's not invasive. One thing to keep in mind, this study was industry funded, so we always have to remember that when we're critically evaluating the literature. I'm excited to see where this goes and to see if it's really helpful for patients.